How do I determine if therapy will benefit me? That's the topic of today's interview with Dr. David Day, a licensed clinical psychologist. He's an established therapist, a well known clinician, teacher, speaker, and facilitator of seminars, workshops, and retreats. So, Dr. Day, I've been struggling with some problems and considering talking with a therapist. So, how do I determine if therapy will benefit me?
Well, it seems like such an obvious question, doesn't it? That you'd wonder whether therapy will benefit you, and it would seem like there's an obvious answer that yes, it will.
Yeah, but those of us who haven't experienced therapy, it's just a big mysterious world.
Yes, it is. There's a lot of unknowns to it, and there's an interesting, complex process that people go through in deciding to get therapy. And frankly, it involves a lot of mixed feelings. And I would say most people procrastinate about seeking professional help. It's understandable. We're all independent. We want to handle our problems ourselves, and many people advocate for that. And in fact, they're skeptical about therapy and suggest that it's a waste of money because you can figure out your problems yourself. Um, and many times you can. So, by all means, I encourage people if they are doing research on their own, they're talking with their friends or their spouse, and it's helping, and things are changing. By all means, continue. You don't need a therapist if you're making progress. Um, but I would have to say, in this process that's complex and difficult to sort out, the net result is that people often will wait too long to seek out a therapist. And so I frequently am invited in after things have become a crisis. There's an ongoing difficulty in a marriage, and it gets to where somebody has an affair, or there's a big blowout and there's a separation, um, or somebody waits until they're actually feeling suicidal, as opposed to facing what turns out to be depression much earlier in the process.
Now,
So
is that typical that people wait too long?
it is, honestly, yes. It's been my experience that it's less common that people will seek out as a therapist as a preventative measure. Uh, Although I do have to say, in recent years, maybe the last decade or so, people have gotten a lot more savvy about psychology, and so they're looking for a therapist sooner. Um, the advent of coaching and related professional input that isn't necessarily clinical takes a lot of the stigma out of it, and so I'm finding that people are getting into the process sooner before it becomes a problem.
Is the outcome better if you get in sooner?
I would have to say yes. I don't know particular studies to cite on that subject, but my experience with clients is that if they're coming in earlier in the process, it's less intense. It hasn't developed into a crisis. You're more able to think clearly, and so it does help things if you seek out therapy early in dealing with whatever it is you're dealing with.
What kind of different practices are there? You were talking about marriage difficulties. I'm sure there's all kinds of issues where people could benefit from seeking out a therapist. Can you kind of go through the various kinds of specialties, or is that everyone pretty much a do it all kind of therapist?
Well, there are certainly specialists in our field, and for example, I specialize with couples. I'm a sort of a rare psychologist who specializes with couples. Um, and then I would say, by and large, most marriage and family therapists or other master's level therapists are more general practitioners, if you will. Um, but for example, one of the specialties in our field is with trauma. And although I haven't had specific specialized trauma training, I would say I'm trauma certified or conversant. And but if someone has a very complex trauma, I would probably refer them to a trauma specialist.
What is it? What do you mean by a trauma? Explain.
Oh, well, a trauma is an event in your life that is overwhelming and you're unable to really handle it. And uh, this is kind of a touches on a pet peeve of mine, and that's that in popular culture, a lot of people adopt psychological words, um, and they lose a lot of meaning the more popularized it gets. So, for example, one of the most popular terms I'm hearing these days is to claim that someone is gaslighting you, and
Right.
and I think people use that in a very broad sense that it's anytime you don't like something that someone else is doing to you, and when they don't admit it.
Mhm.
But gaslighting isn't even a psychological diagnosis. It's a term actually that comes from a play back, I believe it was in the 30s, that someone wrote this play about a man who was turning off the lights in the house and then telling his wife that she's crazy, that the lights have been on the whole time. And so he's purposely trying to make her crazy.
Trauma is deeper than that. It is really when you just don't know how to handle something.
Well, and it's psychologically overwhelming. If you look at the uh, symptoms, the typical symptoms, there's at least temporary amnesia. There are flashbacks. There's something we call hypervigilance, where someone is very anxious about their environment and scans constantly after they've been through an overwhelming event. Um, and then there's other more subtle symptoms. The trouble again, though, with the word is it's used now in popular culture just to mean anything that hurts you. Um, and there's just many things in life that hurt us, but not all of them are actually traumatic.
So I've been coming to you for a while. How many sessions normally does it take for me to determine whether therapy is benefiting me? Is that kind of a mutual thing between you and the client, or help me understand that?
Well, I mentioned to people when I first start with them that you'll know pretty quickly if there's progress being made. So I would say within a handful of sessions. So um, in fact, you'll probably know within a session or two if you're making some progress. Part of that is reflective of my approach to therapy. The classic approach to therapy is a slower process. It's more of a providing a sounding board and being a listening ear. And to be sure, having someone completely listen in an active way with no distractions and actually taking in what you're telling them, that's a rare thing and extremely valuable. But people also expect, and I believe they're entitled to expect, that there will be some input from the therapist that will guide them. In fact, I'm often told by clients that seek me out that it's refreshing to talk to me because their previous therapist, although they were a good listener, never really offered any practical suggestions or guidance. It surprises me that I hear that feedback.
Hmm.
If you look at the length of time, though, I think your question had partly to do with that. The average length of time that someone is involved in therapy, it turns out it's about 25 sessions. So usually we'll start weekly, and I suggest that to people, all things being equal, because the you get some momentum going, you get some regular focus on the issues. If you meet less often than that, you tend to lose focus. You even lose focus sometimes in a weekly session.
Hmm.
But many times we can leave more time in between sessions as the process goes along, because you're learning principles and you're putting them into practice. And the time period discovered is probably a year, and it turns out to be about 25 sessions in the course of a year.
Well, this has been a fascinating discovery for me, listening to the process and how you would determine if therapy would be of benefit. So, if you're interested in talking to Dr. David Day, the information for how to contact him is across the screen. Thank you for this interesting conversation. It's very, very beneficial.
Well, thank you, Stan. It's good to be with you.
Thank you.